Welcome to the Roundtable Consult. I'm your host, Dr. Mark Williams, and I'm joined as always by my wonderful co-host, attorney Sonia Madison. How you doing today, Sonia?
I am ready for the Super Bowl, or I should say the Taylor Swift and Company show. What are you?
Hey, it's all political. It's all political. It's all to get Joe Biden in there. That is crazy. Who you rooting for?
I mean, I don't necessarily have a dog in the fight. So, I mean, they're both wearing red. So, I can't lose either way, right? But I guess
Well, in
I
that
had to go
regard,
for
I'm probably
one.
the same.
I know I had to go for one. I guess the Kansas City. But again, to the 49ers, I have no dog in the fight. So I don't care.
I know my wife would not like to hear me say I would go for Kansas City as well, but I'm all about getting a new goat going on around here. And so another Super Bowl under the cap of Mahomes, that would be good. So
So let me tell you, as the medical expert, what do you think about President Biden? And do you think we have reason to be concerned about his mental capacity, or do you really think it's just a dog and whistle show to give people fear for Kamala Harris?
well, I'm glad you said, let me tell you as a medical professional, because you didn't ask. But I mean, I think both of the candidates are displaying some signs of advanced age and some level of, I think, dementia. Some you can question whether or not some of the responses in one is worse than the other one. That's matter of debate, and you can have whatever position on that you want. I do think that, of course, you're referring to the report, her report, the special counsel, her released this report this past week and said that they will not bring charges against Joe Biden. Said that there was evidence that he willfully withheld the classified documents and shared them. But the reason why they're not going to prosecute him is because he would appear sympathetic to a jury with his lapses in memory as an elderly person who can't remember anything. And so they didn't believe that they could get a conviction based off of that. And I thought that was pretty insulting. I thought it was a little, I thought it was a little editorial, more editorial than it really needed to be. But there are some real questions if you can't remember significant dates. And I guess they said in the report that he couldn't remember the date that his son died, and several other very important things that went on during the interview. And I've said often that I am impressed that this 80-year-old man can articulate, who first of all has a speech impediment, who can articulate a fund of knowledge, a wealth of knowledge about current geopolitical events, and still talk intelligently about those things. I think that's pretty remarkable for an 80-year-old man. But truth of the matter is that, yeah, he's 80-year-old. He has an 80-year-old brain. And Donald Trump has a 77-year-old brain. And so
Oh,
not to
that's fair.
discredit, not to discredit any one of them, but we just know that medically speaking, the brain ages, and no matter how much Sudoku you do, you're going to have some deficits. And so, yeah, I think they made much more of it out of it. It's unfortunate. I think that we're going to have a rematch, a repeat of a Groundhog's Day of 2020.
Oh, you was really hoping Nikki Haley would pull this out, huh?
I was really hoping that Michelle Obama would have stepped up
All
there.
right. Over the girl who's been adamant that she will not run for political office. She's like, oh, come on, for the good of the country. I mean, again, I think this is really more so about, oh, that means Kamala Harris would be president if anything happens to Joe Biden. And that sparks fear in people unnecessarily. But nonetheless, that's what politicians do. They feed off the fear. And I think that's what the Republican Party is doing. It's interesting enough how they have tried to impeach a guy
Hell yeah.
and failed miserably. Which again, you're kind of looking like, why, Speaker Johnson, why would you bring anything to the floor unless you know you have the votes? If you don't have the votes, why are you embarrassing yourself? you
I
know?
don't know that he embarrassed himself. It was the Democrats more that embarrassed him because the who was it, Green? Congressman Green decided to show up in a wheelchair, even though he had surgery, I think, earlier that day or so.
Well,
They
that
weren't
sounded
they weren't
embarrassing.
counting on that. So
But still, I mean, they had some Republicans that did not vote for the
yeah.
impeachment. And then again, the bill that they're refusing to put forth, the immigration bill, that was they're doing because they said we're not going to give you money for Ukraine unless you agree to put forth the bill related to immigration. So then you have Langford put forth the bill, work across the aisle to do so, and you still say, no, we don't want to look at it. I mean, at what point am I, now this is my point, my question to the American people, at one point are you guys saying, okay, this is enough. This is not supposed to be reality TV. This is supposed to be government. Enough.
I don't think that we will. We live in a reality television, sensational, salacious society. In any case, those are the things that sell. That type of
Yeah, but we're not trying to sell here, government. Government,
debauchery.
we don't want government to be the business. We understand you have to run like a business, but we don't want you to sell a service like a business.
But there's a reason why it sells, because it appeals to our most base components and our most base ideologies and, or base characteristics, I should say. And unfortunately, that's where we are. We are a state of people who favor a state of chaos. It's entropy at its macroscopic level. Everything favors a state of chaos and disorder, and that's what we do as humans.
Yeah, but I mean, we've escalated it so much because again, and I'm sure every generation will probably say, the new generation is worse, but it's not as if government is some new phenomenon. So the fact that, again, back in the 90s, that was hard for me to tell the parties apart. It would be kind of a thin.
But that's because you were what, 22 back in the 90s?
I was in my teens, but I hadn't even quite graduated from high school. But nonetheless, now there's such a stark difference. And I know they've been talking about, oh, we should have a third party. And I think, what was it, Governor Christie saying, well, Democrats, we want you to put forth another candidate. Don't use Biden. And my response is, first of all, unless your house is clean, don't go telling no one else's house what to do. But secondly, these are the two candidates. So if you're telling me you would prefer to vote for one candidate who has been vocal that he wants a dictatorship over another, I'm looking at you. I'm not looking at the one that's trying to promote democracy.
But do you agree that this is the most ripe time in our lifetimes for a third party candidate?
No, I think it would be dangerous. It would be the one for Trump. Trump has too many loyal people that will go. I mean, despite what we say, that last election, he still garnered the most votes in history. I mean, Biden still won out, but I mean, he still made records in voting. So no, this isn't the election for that. Now, we could talk about it for the next one. This is the one for that.
Well, what if it were another conservative third party person? And then he'd still probably get 30 or 40, he'd get 30 to 45% of the vote of the Republicans. And then the other 65, where did the other 65% go, or 60% go? Possibly to another, to a third party candidate. And so I think this is a ripe time for a third party candidate. I think that people are more likely to, I don't know if it would be more likely to vote for the conservative versus a more left-leaning conservative person, midline person.
I think with the passage of some of these Supreme Court decisions, I think underneath, for the most part, people do like the fear that Donald Trump invokes. The problem with them is his rhetoric. So to me, if he got rid of his rhetoric, but continued with his policy of oppressing people, people would still vote for that. Because, I mean, I don't know if you got to see Origin, but people do like this caste system. They do like this hierarchy of, well, maybe I'm at the bottom, but at least there's someone below me. And so that's why I say it would still be a fear that, yeah, you've got a Donald Trump just minus the rhetoric, and I don't want that either.
Well, I was going to ask the question, but I think it's going to spark a whole other conversation. But don't people really need to know what their place in society is, what their role and what their
Again,
position in
like
society is?
if government is supposed to be about protecting the most vulnerable, about protecting the poor, and yet you want to use government to restore or to maintain a hierarchy, I don't like that. That to
Well,
me
who
is
said that's what
dangerous.
government's supposed to be about, though?
Oh, I'm sorry, the Constitution, we the people. I don't know. You tell me. You tell me. Did the
But it,
Constitution? I mean, aside from us being three-fifths that we did eventually remove, are you saying government is meant to maintain a hierarchy among its people?
I'm not saying that it's meant to protect the most vulnerable among us. I think it's intended to protect its citizens, and I don't know whether that level of vulnerability is a factor in it. Of course, I don't know the Constitution, but I think government has a role in protecting its citizens, and maybe the ones that are most vulnerable needs the most protection. Maybe that's implied or inferred in its role to protect the people. But I don't think that there's a lot of people who believe that that the government should preferentially protect the vulnerable. And because the people who are not so vulnerable will say, I need protection from the government just as much.
Well, maybe, but there's a reason why the 13th Amendment was put in place. There's a reason why the Equal Protection Clause is in place. There's a reason why, even when it came to women's rights, there was an amendment for that. And those to me are, it was there, those are the most vulnerable and they need the protection. I understand what you're saying, but I'm saying, well, if it's not but for that, what are we using government for?
Yeah.
I mean, it's not supposed to be some kind of private business in which you just pay money and then we just decide how we want to spend it, and regardless of whether you think it's right or wrong.
Right.
You
I
know,
think the argument today is that those people groups are no longer vulnerable. And there will be people who
depends on who's making the argument, right?
people make the argument. Depends on their
Who's making the
perspective.
argument. Because
So
now you got the Trump saying actually the most vulnerable are the white men, or the most vulnerable are, everyone who is legally here being protected against the rapists, the murderers, or whatever that Donald Trump wants to classify as illegal. And again, we see it with Texas. You're tightening a border when in reality the terrorists, the most domestic terrorist group are KKK, the white supremacist group, but yet we do nothing to carve out that. So
well,
I
he
mean,
does nothing. So I won't say that we do
well,
nothing, but
that's
yeah,
true. That's
the
fair. That's
government
fair.
does something. But before we move on, I did want to get your thoughts. This past week, the Supreme Court heard arguments in the Colorado case about whether or not to keep Donald Trump on the ballot. What are your thoughts on that? Are they going to overturn the state
All right.
Supreme Court decision?
Some of the articles that I'm reading, because I didn't listen to the oral arguments, but some of the articles I've read, it seems to lean towards them allowing Colorado to stand.
Hmm.
Which I think, again, if you are a staunch Republican, you're supposed to be about small government. You would not want the government, the federal government, to tell you your state what should be or should not be in your constitution. But that's what I'm hearing, that it's leaning more towards in favor of Colorado, which I think would be wonderful. Now, it doesn't mean, as we saw in, I think in Nevada, when people are just writing in, none of these candidates that won out over Nikki Haley, over your candidate. I mean, I don't doubt people may still write him in, and that may be what happened. But I hope that the Supreme Court will affirm Colorado's decision. What about you?
Now, I was hearing the opposite, that they're more likely to overturn the state Supreme Court decision. And in fact, I heard some of the arguments at Ketanji Brown Jackson. She was pretty animated about some of her questions, and the line of her questioning actually implied that she was inclined to overturn it. And so there have been some people who speculate there's going to be a 9-0-8-1 decision overturning this Colorado Supreme Court ruling. And so I just don't, unfortunately, I do believe that, presidential elections should be run by the state. The big challenge is that if it's run by the states, what's to stop the states from getting a little too carried away with saying this person is ineligible about being on it? Now, granted, yeah, there are certain protections afforded to us under the Constitution. Yeah, you can't say that they can't run because they're black, or because they're a woman, or because they're a homosexual or something like that. Yes, you have those protections, but there will be some other kind of way where crafty lawyers and attorneys, no offense intended, will find
Sure.
a way to exclude a prominent candidate from that state's ballot as a mechanism for interfering with the national election. And I get that's a very real concern. And
Well,
that's
to
something
me,
that
it's
the
not
Supreme Court has
though.
to
I mean,
address.
to me, it's not. This has been in Colorado's constitution for years. And so it's never been a concern now. And the only reason we're bringing it up is because someone has incited a insurrection. And so to say that, man, we're about to go down a slippery slope for what? They started something new and all of a sudden we're seeing it play out. Oh, this is an old law that's been on their books for years. I'm sorry, we now have a candidate that likes to disobey laws.
But
But that shouldn't change the fact that this has not been a problem up until now.
But they're referencing the 14th. I mean, is it the section article? Well, I forgot what section is. Section 3 of the 14th Amendment or something like that, or
You in the
whatever it was.
Colorado Constitution. I think it's Section 3, but I'm not sure. You talking
Section
about
3 was that the Colorado Constitution?
Colorado Constitution?
I
Exactly.
thought the basis of their ruling was based off of the United States Constitution that
They're
says no.
analyzing Colorado's Constitution, yes, in comparison with the United States Constitution, but we're looking at two different constitutions here.
Hmm. Interesting.
No, it gets a little complicated.
We'll see what happens. We'll see.
But I mean, I guess I'm just saying I don't want people to feel like, oh, this is what I'm talking about. Government is now going downhill, blah, blah, blah. No, we've had one man in office that has caused a lot of disruption. Don't take that to mean all of a sudden he's exposing all these holes in our government. No, there were mechanisms in place to avoid this type of candidate for years. It's just now time to use them.
Why don't you just tell us how you really feel, Sonia?
I mean, I can't help that he's got states charging him left and right, and he's already, been on the hook for 83.3 million.
Well, amen. Well, it's Black History Month, y'all, and we're so delighted last week to have oh gosh, Tiffany L. Burgess on to talk about entertainment and Black faces. No, I haven't forgotten about it. But one of the things we did want to focus on this month is Black Health Matters as well. Today we're talking about Men's Health Matters. And we are delighted to have on the show with us today Dr. Kevin Billups. He's a highly experienced urologist and men's health specialist with over 30 years of dedicated practice in the field. He utilizes a unique approach that combines traditional medication with lifestyle changes such as improved nutrition, increased exercise, better sleep, all to address common medical problems and conditions such as diabetes, obesity, hypertension, erectile dysfunction, low testosterone, and prostate health. He graduated from from Harvard University and the Johns Hopkins School of Medicine, completed his urology residency at Johns Hopkins Brady Urologic Institute. He is currently a professor of internal medicine and urology at Meharry Medical College, where he's also the director of the Men's Health Program and the chief medical officer for the Health 90 Lifestyle Medicine Program. Well, you are welcome to the Roundtable Consult, my friend, my brother, Dr. Kevin Billups. Sir, welcome to the Roundtable Consult.
Thank you, Mark. Sonia, good to be here.
Good to have a real doctor on the show.
Oh, listen, the hate comes early, I tell you. Well, Dr. Billups, I know that there's so much that we can actually talk to you about just because of the breadth of your experience in terms of dealing with just with men's health. But today, actually, I want to give you the opportunity. First of all, tell us a little bit about some of your community activities and what some of your focus and passion is right now.
Sure. So I'm a urologist by training, but my practice is very different. So I initially trained as a sexual health expert, looking at erectile dysfunction and low testosterone. But what I found was I used that to engage men, because what my practice really is now is much more of a preventive health for men. So, for example, the problems that I mentioned, I'll use erectile dysfunction as an example. A lot of times that is often related to medical problems that men have. So diabetes, high blood pressure, being overweight, being obese, things like that. But they'll come in for erectile dysfunction. So I started noticing that, and then really just started focusing more on, well, let me use that to get you into the office. And then we really need to check under the hood for everything. Because what a lot of people don't know is is erectile dysfunction can precede a heart attack or a stroke by up to 6 years. A lot of people don't know that. So the emphasis was actually on looking at things. And then over the last 5, 6 years or so, have really gotten involved in looking at lifestyle changes, food as medicine, proper exercise, sleep, that really can, to be honest with you, reverse or change a number of those health conditions that I talked about. So it has implications for all the diabetes and heart disease, but it also has a lot of implications for your prostate health. And so, I've noticed that for myself, 7 or 8 years ago, when I was like many doctors, completely stressed out, overweight, just doing everything except taking care of myself. And I was very fortunate that a friend of mine literally just grabbed me and pulled me aside and said, "You need to come to a program that I'm putting on." And I put him off for a year. I was like, "I'm not doing this." He said he told me it was a how to eat better. And I was like, "No, I'm too busy for that." And finally went and listened to what people were saying. And I was like, I can't ignore this. It was all evidence-based stuff. And Mark, you're a doctor. So and so I'm like, I'm ignoring this at my own peril. So I jumped in cold turkey and did it. And, make a long story short, over like a 4-month period of really kind of changing things around, it probably dropped about 40, 50 pounds. All the kind of early blood pressure, cholesterol problems went away. And I started putting it into my clinical practice. And the results I've seen have just been unbelievable. So it's changed the way I practice medicine, as probably as well as probably saved my life or changed my life too. So that's kind of what I do. It's a little different than the average field of urology, but I enjoy it. I enjoy it. So,
well, fantastic. It's kind of like the men's hair club. You're not just an owner, but you're a client as well.
that's right. That's how I started. I don't think it would, because I don't know how much nutrition you was taught in medical school, but I was taught essentially none.
Mm-hmm. Pretty much the same.
Yeah, and so I've made a big point with my students at Meharry is you all need to know about this, and so we talk about that, and I let them know this can have a major impact not only on your own life but on your patients' lives. So yeah, it's exciting. It's exciting. So I always love sharing this information.
Well, I know we've got a lot of viewers who would probably love to hear particularly some more about the alternative medicine pieces, because there's, as you are aware, there's a growing sect of the population that believes that that all Western medicine has nefarious intent and that the goal is to keep people on medications. And now we've got some medical doctor here who's Harvard and Johns Hopkins trained, who is now saying, "Hey, there's some truth to this aspect about food as medicine." And so, where does that conversation normally start for you with your patients?
So, well, now, especially since I've kind of gone through this myself, when I looked at this, I said, uh, the way I used to approach lifestyle was we would listen to you, and I'll use diabetes for an example. If you had diabetes and different things going on, and we would kind of listen, and then we would be thinking in our minds, here's the medicine that we're going to put you on, and this is how we're going to follow you. And then almost as a little bit of an afterthought, I'd say, oh, you know what? You should go eat better, exercise more, and do that. And then like, what does that mean? what does that mean? So people would come out and they come back with the same issues going on. So I kind of realized that we didn't we weren't emphasizing that enough. And so what changed for me was one, especially when it impacted me, I really would spend more time kind of focusing on how to approach this with my patients. And one of the simple questions I ask people after I talk to you, I just say, I listen and I kind of say, so are you just curious about your health, or are you serious about your health?
Hmm.
And so they'll look at me, and most of the time, especially with men, but once they're in the office, they're not going to back down. So, oh no, I'm serious, doc. I'm serious. I was like, okay, well that's good. That's good. So let me ask you this: are you willing to face the things that are making you sick? Now, that's a little tougher question, right? But again, most people aren't going to back down, so they say yes. So I say, well, great. So here's the good news. The good news is I'm sure I can help you. The first thing is, let's really level up on what your lifestyle is. What are you eating, exercise, and all this sort of things. Because what I tell people is, and you kind of alluded to this, medications are very good at treating symptoms, but the lifestyle, the food, the nutrition, all that, that gets to the underlying cause.
Mm.
So do I, I still use medicines, of course, but I tell people my goal is, if possible, I want to get you off of the medicines. I want to get to the root cause and correct that and get you off. And we're seeing, amazing things with what's going on. The toughest thing is, uh, as a fellow physician, I know is, how do you get people to do this, right? Because you're fighting the taste buds.
I don't get
Battle of
myself
the
to
taste
do it.
buds. It's hard, there's a reason why you can't eat one or two chips. I tell people, you pick up that bag of potatoes, you can't eat one or two. The bag is half gone or all gone before you're done. It's those processed foods that are getting to us. But we're making some headway with the Heal 90 program and things that we're doing there. So uh, it's fun to see, and it's fun to do. And like I said, I enjoy it. It's got a long way to go, but we're getting there.
Now, we've had in the news recently, Dexter, I think that's name, Dexter Scott King, Martin Luther King's, Reverend Dr. King's son, just recently died at age 62 of prostate cancer. We've got Defense Secretary Lloyd Austin just got into his big trouble because he was diagnosed with prostate cancer. It's speculated, I guess, that King Charles is now at least he went in for a prostate procedure, and now it's pretty public knowledge that he has a cancer, presumably, I guess, prostate cancer. Many of us think about prostate cancer as obviously it's exclusively to men, but we don't usually make a connection between prostate cancer and prostate health with diet. Maybe you can share a little bit with us about prostate health and prostate cancer.
Sure, you're absolutely right. That connection has not been very well made in the past, but there's some very interesting studies now. Are you going to put? Yeah, you want me to run through this a little bit? Maybe I can.
Yeah,
Yeah. Let's start out with where on the next one, where the prostate is, because it always, to me, sometimes men don't even know where their prostate is and what it does. So you see there on the left-hand side your prostate. So the first question I always get asked is, what does the prostate do for us as men? We know it causes us trouble, but what does it do? And it does have a function, when we're younger in terms of reproduction. The prostate secretes an enzyme that liquefies your sperm. So it does have a reproductive role. Now, as we get older, unfortunately, either it can get enlarged, and I'll talk about that in a second. That's called benign enlargement. That's on the right-hand screen there. And what happens there is you can get tissue, the prostate grows, and it actually blocks off your urine stream. Because if you look where the prostate is, on that one back on the left, you see the bladder up top, then the prostate, and then the penis there. So your urine has to flow from the prostate from the bladder through the prostate and on out the penis. That's how your urine flows. So when your prostate enlarges on the inside, that benign problem, what you can think about it is, if you're squeezing your fist and your urinary stream was running through it, it's blocking off your urinary stream. So the symptoms that men get there are your stream becomes slow. You might have to go to the bathroom frequently. Urgently you have to get there. All those are signs, common urinary symptoms of benign prostate enlargement. Very common symptoms. So that's one thing. The second thing, of course, is prostate cancer. And so that's the other thing. The prostate can develop cancer. So let me point out one thing on the slide, because this is another question I always get asked. Why do I have to get the dreaded rectal exam? Why? And I just had a colonoscopy a few weeks ago. Does that count? So on this left-hand picture, two things. You see the rectum there. That's where the arrow is there. So your prostate is right next to the rectum. So when we do that digital rectal exam, we can actually feel your prostate. So one is, I can feel if there's something abnormal there. I can get an idea of the prostate size. I can get an idea if it's inflamed or infected. There's a lot of information that I get out of the digital rectal. And unfortunately, that's the only way that we can do that, right? The colonoscopy is a scope that's looking at your colon, so it goes right on by the prostate. So that does not count as a prostate exam if you've had a colonoscopy. We have to do that. Now, most of us, when we do this exam probably takes 10 seconds or less. It can save your life, because one of the things that I'm sure you were asking about is what are PSA levels, prostate specific antigen, the blood test that people use to look for prostate cancer, which is good, but the exam does give you some useful information. And the other thing, like I said, is you can also get inflammation of your prostate. So at least in my experience as a urologist, I still find use for the digital rectal exam because it gives me some additional information.
So let me ask you a
So
question while we're still on this slide here.
yes,
And looking at these pictures that are depicted here, you would presume that the prostate is circumferential around the urethra. Is that,
yes, that
and
is
so,
correct.
but when you're doing a digital rectal examination, you're only able to palpate the posterior aspect of the gland. What about the anterior, or are you able then to compress the urethra and still feel even a nodule that would be on the front part or the anterior aspect of the prostate gland?
Yeah. So basically, what we can feel, you're exactly right, is the outside of the periphery. That's where most prostate cancers happen. So if I feel a nodule or something suspicious in your prostate, it's usually on the outside. Now, I can't feel the inside, and you can get cancers on the inside. It's a much rarer occurrence. The inside is usually that benign growth. So you're right. What the rectal exam doesn't help me with is predicting how many urinary symptoms you have, because I can have men that have a huge prostate on rectal exam, eh, but their inside isn't blocking them and they're doing well. And men that have a normal sized prostate and their inside is blocking them. So the only way we can actually take a look at the inside is to take a flexible scope and go up through the penis and then take a look directly at the tissue that's blocking you. And if the tissue is blocking you, there are medical treatments that we can do to open that up. But if it's bad enough, you may have to do a surgical treatment. It used to be referred to as the roto-rooter, which is a very crude term, but you really were coring out tissue. We can do lasers and all kind of things. There are all kind of things now. The reason that your question is even more important, so you're right. I can't feel the inside, but what you don't want to happen is you start out with urinary symptoms. And what happens is initially when your prostate grows and blocks you off, your bladder just becomes really muscular and it can push past the obstruction. And so you end up doing okay, or you think you're doing okay. But what happens is as the bladder becomes muscular, all that pressure to push past the obstruction backs up into your kidneys. So you can actually get kidney damage, and your bladder muscle at some point will give out. And if your bladder muscle gives out, that's not a good situation, because then we can open things up, but it doesn't matter because you don't have any muscle to push the urine out. So when you start getting these symptoms, it's better to come in sooner rather than later, because there's a lot of things that we can do sooner. You don't want to get to where you waited, and then when you come in, and that's good of anything, right? That's the benign of cancer or anything, but that's just a little extra on.
Well, and I want to make sure the layperson understands what you guys are saying. So are you saying that the prostate is there to help make sure you can pee? Or is it there? How does it relate to like UTIs, or when you even talk about symptoms, what are they supposed to be feeling to then know, okay, something might be wrong with my prostate, let me go in?
Yeah, so it doesn't help you. It doesn't help you urinate, because what it did when you were younger was an enzyme was secreted that actually would liquefy the sperm, because when you're trying to reproduce, your sperm comes out in a gel form and has to liquefy. So as Mark was saying, the urine has to pass through the prostate. So what happens is when it enlarges and causes you problems, it interferes with normal urination. So it makes so it's more difficult to urinate. So the symptoms are, first you'll notice I can't go as long as my stream is much slower, and you maybe even have to like push to get things out. And then you'll start noticing, man, I better get to the bathroom right away, or I'm going to leak myself. I'm going to wet myself, have some incontinence. That starts happening, and those things can get progressively worse. So what I'm saying is when you start to see those symptoms like that, you want to come in. The infection comes in when your bladder just doesn't empty well and the urine is sitting in the bladder, and then then it can get infected. So that the infection is actually a symptom of your prostate being blocked or obstructed, things like that. So yeah. So does that make sense? Does that
It
help?
does. It makes sense.
So as you mentioned there, the digital rectal examination, so you still recommend that as a urologist today, because obviously there's a lot of other stigma, particularly in a lot of the Black communities, about having their rectum digitally examined or penetrated by a physician in order to get that. When there are other ways to find out whether or not you have prostate cancer, is that primarily what we're looking for? Is just to find out, are you having problems with that are suggestive of prostate cancer, or are there other things that we need to be looking out for that the PSA may not necessarily tell us?
Yeah, my feeling is that when I examine you, there are things that I'm looking for that PSA can't tell me. You know, I'll give you an example. Is some men have one. It'll give me an idea just of how big your prostate is. But if your prostate is tender, if it's sore, you get something called prostatitis. That's an inflammation. And it's usually not a bacterial inflammation. It's usually kind of just a chronic non-bacterial process. But it can affect your erections. It can give you pelvic pain. It can do a number of things. So if I don't examine you, I don't know that. The other thing that I pick up a lot in men is lumbar disc, low back disease. So when I examine you and I go in, if the sphincter when I'm going in, the way you can squeeze, if that's decreased, a lot of times either I'll pick up disc problems or I'll say, hey, have you had any low back or disc? And they'll say, oh yeah, I forgot to tell you that. But yeah, I had disc surgery or something like that. So I get useful information out of it that the PSA doesn't give me. But that may be, but that's, as a urologist, I would hope I would get useful information out of it. But so there's a rationale in terms of why I do that as part of my exam, at least yearly.
Yeah.
And now, are you suggesting that if a guy eats better, or I guess, because I wonder what does hereditary have anything to do with? Because I know oftentimes people say, well, if you have a certain gene, you're more likely than not. But yeah, how does food and hereditary, how does all that play in it?
Yeah, so some prostate cancer can be hereditary, and there are certain genes that can predispose you to, but that's not the majority of prostate cancers. For Black men, for African American men, actually, I'll just kind of run this slide, kind of gets to some of that. So if you look at all men, about 1 in 8 will be diagnosed with prostate cancer at some point in his lifetime. 60% come at age 65 or older, but do not let that fool you. I've seen plenty of men with prostate cancer who's younger, and I think that's particularly important for African American men, as we talk about PSA screening. The main thing is only 1 in 41 men will actually die of prostate cancer. So most men who are diagnosed with prostate cancer don't die. So the thing is, it's better to know than just not to know, because we can get the treatments later with what we can do. Now, if you look at African American men, we're about 1.5 times more likely to develop prostate cancer, and we're about 2.5 times more likely to die from prostate cancer than white men. And we're also less likely to be offered PSA testing. So, people always ask me, well, do you think prostate cancer is different in African American men? And I think it oftentimes is more aggressive. There can be some genetic basis, for that. But the actual link is, if you look at when should you start getting the blood test, the PSA test, African American men are considered to be in a high risk group. So we should start getting that at age 40. If you're African American and you have family history, because the other thing is, if you have family history in a first degree relative, a father or a brother, especially 65 or under, who has a history of prostate cancer, that also puts you in high risk, whether you're African American or not. So even white men with family history are at high group. I see a lot of men who are African American with family history. The recommendation is still starting to get the PSA at 40, but a lot of times, and I've told my family members who were in that situation, look, you probably should go in a little bit earlier, because you are at much higher risk. So there's a familial component. I can get into you want me to talk about the food piece now, because the food piece is actually pretty important that Tanya was mentioning.
Absolutely. But also, before you do that, tell us what PSA is actually,
sure,
and how is that useful?
Yes. So PSA stands for prostate specific antigen. So that is a blood test. You can get that as a blood test, and the quote unquote normal range is 0 to 4 for the PSA, but that can be misleading depending on your age and a number of different factors. That's a ballpark range. But depending on your age and things like that, there are different parts of that range. But it's a spectrum. The point I always want to make about the PSA, prostate specific antigen, it is not a perfect test. There are other things that can raise your PSA besides prostate cancer. You can have a huge prostate. And that's one of the reasons you're like, well, I don't want to do the digital. If you have a huge prostate, that could raise your PSA. If you have that inflammation that I talked about, so that's another, and checking that on your exam, that could make your PSA elevated. Even just if you've had sexual intercourse or ejaculated over, within a couple days before, that can raise it. So one of the first things I'll do if I see a high PSA, to me it's a sign of potential prostate problems, and we need to be looked at a little more. One of the first things that I'll do is I'll repeat it, make sure you haven't ejaculated for 3 to 5 days, repeat it, see where you are. But that's what it is. It's a blood test. Like I said, it's not a perfect test, but I believe it's a useful test in terms of looking for prostate trouble.
So if I'm a 50-year-old Black man with no problems with urination and a normal PSA, do I still need to get a DRE?
That's a loaded question. I mean, I guess.
And did tell us what a DRE is while he was still
I'm sorry.
acronyms.
Digital rectal, that's the dreaded exam. Mark's doing his best to help guys get out of getting that rectal exam.
Which is a big part of my question is to, we don't tend to go to the doctor as much. Does that have anything to do with the numbers as to why we may be more likely than
yes, we do tend to procrastinate and delay. And so you're absolutely right. That does have something to do. And then
I'm Mark is encouraging it, right?
but Mark is giving him, he's saying with that, go get your blood test, but don't get that. Now, you know what's funny is you talk to women, because what I'll do a lot of times is the man and his partner or wife or partner will come in, and I usually deliberately sit the man in front and sit the wife or partner behind, because I want to get real answers. So I'll ask him about this, and then whenever we get to the rectal exam, they start, I don't know, doc, and then they turn back and look, and the woman will say, "You better man up. I get a pelvic exam every year. I go
you get pap smears, mammograms. What are you talking
about?" No, and I'm sitting there like, bad move. You should have just, so.
Well, in my defense, I'm looking at the statistic that you showed that we're almost 2.5 times less likely to even get a PSA.
Right.
We don't even get that. And so I will tell you, I do get my digital rectal exam. I'm a surgeon. I believe that there is some value in being able to palpate and feel. Even though I'm 54 years old, prostate is probably a little bit enlarged. I'm giving you all my medical information, but
doesn't eat well.
But even if my PSA, even though my PSA stays normal, I still support getting a digital rectal exam, just because there's just so much more information. And as you said before, we're almost 2.5 times more likely to die from prostate cancer, 1.6 times more likely to get it. So I'm not really trying to give people an excuse to get out, but at least at a minimum, we should be getting a PSA, and you should at least have a DRE still.
And I do want to ask, while you're answering your question, does insurance cover that? Because I'd imagine if it doesn't, that may be one reason why you opt out.
Insurance will cover that. Insurance will cover the PSA, especially if you're in the age range. We know their age range. If you're African American and age 40, if you were a white man with no family history and other things, then it's closer to age 55 or somewhere in that range, unless they have family history. But no, Mark. So Mark, you were given a very real life situation, right? So the answer is, honestly, in the clinical setting, if someone is really hesitant and doesn't want to do it, I will encourage them, get the PSA, and I try and give them some education on why the digital rectal exam is important. And then sometimes it's like, well, maybe we can do that next time. So yeah, I'm not so hard nosed. I'm
After
just
you
like
buy me
not gonna.
dinner.
Yeah.
Buy me dinner first now.
Oh, that comes up a lot. So I was like, all right,
Exactly.
let's get the blood test, and then we'll talk. Now, if the blood test comes back abnormal, then at that point,
Yeah.
it's you all bet, you have to we have to get more reasonable. But
Now, is that something the PSA should be done annually? You said African Americans 40 and above, and
yeah.
how often about a DRE are you recommending?
Oh no, and I mean annually.
Okay.
And both covered by insurance, right? Both PSA and DREs.
Yes, if you get them in the right age ranges, and doctors know, for the right age ranges, yes, they're covered,
I
because
want
they
to make
realize
sure
that.
we ask. I want to make sure we ask as well.
No, that's fine, because you're absolutely right. But most insurance plans do cover PSA, because it's especially if you're doing it the way that we're talking about it under the guidelines, because it picks up problems, and
Well, it sounds like the DRE is an extra step, and so that's why I was really more
depends on who you talk to. This is going to be a circular, because you're never going to convince me not to do it. But I will tell you that there are plenty of that they just don't do them. That they just scream with the PSA and But at least, look, for men, I guess that's kind of a step forward, because at least you're getting something. We can.
Now, there's a key thing here, is that now you're a urologist, so obviously you're going to recommend this each time. But many of us don't go see our urologist. We leave it up to our primary care physician. And I think this is the reason why we see that disparity, that racial disparity in the likelihood of African Americans to get PSAs, and maybe even the likelihood of them getting earlier treatment and a later diagnosis. And that is that a lot of times these are left in the hands of your primary care physicians. I'm finding that more PCPs are saying it's too uncomfortable for me to even suggest doing the DRE. The demands of insurance require spend very little time in with the patient, get in, get out, move on to the next patient in order to remain financially solvent. So a lot of primary care physicians are now saying, I'll just draw the blood work, the PSA, and I won't do a DRE. And so some of them are probably not very facile with doing a DRE right now. My concern is that a lot of times, if we don't ask the question, we'll never get the response. And so my encouragement is to people, address this head on with your physician. Don't wait for your physician to be the one to say, hey, we should do this digital rectal exam, or we should check a PSA on you or something, because they may not necessarily do that. And we have to be a little bit more proactive about our health, because many of us may not necessarily go see a urologist unless we already have problems, correct?
No, that's true, and I have no problem, especially in the primary care community. If they're seeing people and they're getting the PSAs, that's fine. Because if anything, if there's if they're worried about anything else, they're usually going to send them in to a urologist. And I agree with you 100%. It's better to get that test. And also I do educating the general public is very important. To ask if you're an African American man and you're over 40, ask. Hey, I'd like to get a PSA, or are you getting a PSA blood test on me today? So that's why I think educating the general public is important. But I have no problem, because you're absolutely right with the primary care. So I really have no problem with that, because we are looking for it. But if you come to most urologists, I would say most of us are probably still going to do it, but also looking for other things, right?
So we talked some about risk factors, and you were mentioning before we were transitioning into some of the diet and lifestyle things that can increase our risk or decrease our risk for developing prostate. Can you speak on some of those?
Sure. So one of the things, because I was saying in the beginning, I always get asked well, what can I do to decrease my risk of prostate cancer? And so there have been some very interesting studies that have come out recently. looking at, is there an impact of diet and nutrition? And so, I mean, what I'm gonna call mostly a plant-based diet. That means a whole food, plant-based diet, or plant-rich. It doesn't mean that you can't have any meat, but it means that you really limit the meat. There used to be something called the Mediterranean diet that people talk a lot about. Now it's more of a whole food, plant-based diet. And what they actually found was, when they looked at people who had that kind of a plant rich lifestyle, that there was a 19% decreased risk of developing fatal prostate cancer, and there was like a 53% decreased risk of your PSA not being elevated. So there's no question that the way you eat impacts your PSA, and so the prostate specific antigen level being kept in better control might be the reason why there's less prostate cancer. So that's on a preventive note. The other interesting thing, though, is what if you have prostate cancer, right? So one of the things, if you have prostate cancer, one of the treatments that we do now is called active surveillance, which means you get your biopsy, we'll diagnose prostate cancer, but rather than just rushing to go ahead and take your prostate out, if it's a low grade cancer, we'll follow you. We'll follow your PSAs. You'll probably have to get another biopsy at some point. But when studies have shown that, again, that whole food plant-based diet decrease the potential that your less aggressive prostate cancer will become more aggressive, or even men that had more aggressive prostate cancers, it decreases how rapidly the PSA goes up, and what we call a doubling time. That means we're more concerned. So the bottom line is, the nutrition piece, is important. So is exercise and other things, but the nutrition piece is important in really being proactive and preventive. And then even if you get it, helping you there. And that's something that a lot of people don't know. And here's another thing that's the beauty of that. There's no like whole food plant-based diet that is for your prostate. The same thing you eat for your prostate is good for your heart. It's good for your blood pressure. It's good for your cholesterol. It's good for losing weight. All that. It's all the same. So when you're eating that, you're getting benefits of not only your blood pressure, blood sugar, all the other things, but also you're getting benefits for your prostate. So the trick is, Mark, is getting people to actually do this. But I have found that what I just told you about prostate health and that's eye-opening to many men.
Well, for all the wives that are listening, trying to decide what to cook for their husbands to either escalate or decrease their health, are you saying add more plants? Or are you saying take away more of the protein or take away more of the sugars?
No, you need to add more plants. There's some pretty clear studies showing that dairy and meats that that will. So you want to add more plants, limit what you eat. The toughest thing for me when I started doing this was, and I jumped in both feet cold turkey because I one, that's just like how I like to do things, but two, I also thought it wasn't going to work, and I was like, I can do this and fail quickly, and I can get back to my old ways and say I tried, because I had all that evidence put in front of my face, so I couldn't just walk away, And then I did this, and I was like, oh my gosh, 4 months later, 30, 40 points down, blood pressure, everything was like straightening up, energy up, everything was working. So yeah, you want to increase the plants and the way you eat. That's why, and I you could put the Heal 90 is a program actually started with a patient of mine who's also now my business partner. So as I tell you parts of his story, is nothing. I have permission to talk about that, but we had very similar histories in terms of a lot of health challenges, and had kind of changed it to eating. But what I found as a physician, and I'm sure Mark can back this up, is we don't have time a lot of times to talk about lifestyle and tell you what to do. I used to tell you, go eat better, lose some weight, that's good for you, and come back, and everybody would come back, and everything else was still going on. So we developed a program called Heal 90 that's a virtual 90-day program that really tries to fill that gap on how how can we help you make this change? So we do this in cohorts, and I'll say this program, we have men and women's cohorts. So I've been talking about obviously men's health, prostate health here, but this program we have for men. Now we separate the men and women. That that we keep the cohort separate. But nutrition can impact many women's health problems also. But we focus on education and engagement, equipping, really empowering you to act. We do this virtually. We do it in small in cohorts, online communities, and I think what happens is it helps to provide support and accountability as well as the education. Because it's funny, because sometimes when we get on and some of the we call them either cohort brothers or cohort sisters, because brother or sister, it means alignment. So people are aligned in their health challenges, and they'll come on and say, I was eating, I wanted to just kind of slip this week, but I knew I was going to have to get on here and talk to some of you all and let you know. But the success stories we have just, like I said, it's completely changed the way I approach and practice medicine, because I believe so much in what this can do. And then really it's, let me give you the evidence. And I found that when people get the evidence and they see this, a lot of times they'll make changes, because you get to the point where you're just kind of sick and tired of being sick and tired. And arthritis goes away. Lots of problems. I call them non-scale victories. Everybody loses weight. We focus on get your blood sugar, your blood pressure, your cholesterol, and your waist, your belly fat. You get those under control, everything else falls in place. So
we can't just take Ozempic and call it a day. I'm just kidding.
Okay, I'm gonna go. Medicines treat symptoms. Lifestyle and food gets to the underlying cause, So yeah.
So I want to ask a couple of questions that that maybe some of our viewers and listeners may have heard. Maybe some of them are missed or anything like that. Is there some value to routine flushing of the prostate? And flushing, I guess they only.
And these are Dr. Mark's questions. Let's be real.
Well, listen, this. I was told by one urologist that for patients with chronic prostatitis, one of the goals is to flush the prostate. You got two ways to do that: is either massage of the prostate or ejaculation. So, is there some benefit or risk of frequent ejaculations for prostate health?
So that prostate congestion with prostatitis syndrome, I have seen that, and so you're right. Flushing is a nice way of putting it. So flushing, I'll remember that. That's a diplomatic way. So flushing the prostate, no matter how you flush it, and sometimes we would, massage. Now, you can imagine it's harder to get a guy to do a rectal exam, so they really don't, approve of a vigorous massage. But that does help when you get the prostatitis and swelling. So you have to just be careful that somebody doesn't have an acute infection, because if somebody has an acute infection, you massage the prostate, you can actually, make them sick with sepsis and things like that. But so there is some support for that, in that instance where it's ejaculation or the massaging that decreases the congestion. Does that mean that you have to frequently ejaculate? I guess if you had certain sorts of prostatitis, maybe that would be true. So for specific patients, I think that does help. I do see that. Is it a widespread problem? I don't know if I would go that far.
We're not going to promote masturbation here or anything like that.
No.
We're talking about
these are specific. This is flushing, Sonia. This is
flushing. I keep telling my wife that helps with my prostate health.
Yeah. See, that's where I knew it was going to make that turn. I was like, how can I avoid making that turn?
Even Dr. Billups said it.
Trying to get you out of trouble.
No. So there are some specific medical reasons of conditions, individual case by case, where you can talk more about this. So
absolutely, it does seem to.
Out of trouble.
But it seems like it would help increase urinary flow. I don't know whether it's just temporary or not as well.
Well, the urinary flow issue, a lot of it really is it's a physical blockage. I mean, the tissue is just enlarging and just squeezing that urethra. Like you said, the urethra goes through the prostate in a 3D manner. So if you think about that, if it's like a straw in the middle of my hand and I make a fist, the tighter I squeeze, I'm constricting that straw, right? So that's going to cause a urine flow. So there, either you can give medications that can relax the prostate and open things up, or we can do surgeries, or here we go with food again. I'm gonna tell you, you know what is good for relaxing your prostate? Flaxseed.
Hmm.
Flaxseed.
Nice.
I have a smoothie every day, day with different things in it, and flaxseed will work wonders. So again, I'm not anti-medicine, but if food can do some of the same things, then why wouldn't you try that?
You hear that, Doris? Get him some flaxseed.
Now, ground when you get it, you get the flax seeds, but grind it up. So you get a coffee grinder and just grind it up into a fine powder. And you can put it in. I put it in. If they go to our Heal 90 website, we put it in smoothies. I sprinkle it on salad. It works. I'm gonna tell you, it works. So yeah.
So a couple of other myths or wives' tales or anything like that. Wearing boxer shorts increases your risk of prostate cancer. True, false, what?
No, I don't believe that. The boxer shorts thing, the only way I've really heard about that is do boxer shorts help when you're trying to with fertility? Because the thought is if you're wearing, kind of tight underwear that your testes are pulled up against your scrotum, and then the temperature is higher, and that can impair sperm function. So no, to me, the reason we would tell some men to use boxers is if there are fertility issues going on. But that prostate cancer one, no, I don't buy that. I don't buy that one at all. So
the prostate cancer is a higher risk in men who have anal sex.
I have not heard that. That's not a major risk factor that I have heard. So I would say to that, no, or not a major. There are many other things to worry about, way more than that. So where are you getting these facts from?
I told you these are Dr. Mark's questions. I said these are Dr. Mark's questions.
I've had talked to a couple friends. We're going to have this conversation, and so about this conversation, and these are things that came up. I won't tell you where my friends come from. They come from a wide range of backgrounds, and I'm like, well, geez, I don't know anything about this, but I'll tell you what, I'll ask the expert.
No. Tell them if they want good prostate health, like I said, focus on what you eat. That's probably the best path to prevention. And like I said, the beauty of it is it's not just prostate health; it's your overall health, because all this stuff is just interwoven. So yeah.
Including, as you said, erectile dysfunction. Now, it's interesting that usually, as you said before, opens the conversation for men. In fact, when I'm treating obstructive sleep apnea, that's one of the reasons. I mean, that's one of the biggest motivations. One of the things that I pull out to encourage people to use their CPAP machine and say, hey, you want your partner to be working right? And if you don't use that CPAP machine, you're going to have other issues. But I guess nutrition is also, you're saying that nutrition also helps with that as well, with drive.
If you look at the main risk factors for erectile dysfunction, and you talk about prostate cancer, if you have prostate cancer surgery, that's one of the risk factors, right? If we take your prostate out, and that's one of the things we didn't get into, is the difference between the benign surgery to open things up if you need that, and if you have prostate cancer and have to go the surgical route, then we have to physically take the prostate out. So if you go back if you remember that anatomy picture, you take the prostate out, and then we have to hook your bladder up to the penis. So you don't have the prostate there anymore. And the nerves that help to give you an erection run right next to the prostate. So even though we can spare those nerves with surgery, it can cause problems with erection. So that's a specific case of men having some erectile difficulty after that. They can be addressed with proper surgery thing. But here's the honest truth: a lot of the men, even the ones who've had their prostate taken out, one of the main risk factors for their erections is what kind of condition are you in before you come in. So unfortunately, a lot of men might come in, they're overweight, They may have diabetes or pre-diabetes, the blood pressure, everything's going wrong. Well, you're probably going to take a hit, but you have all these risk factors anyway. So the prostate is kind of is a confounding factor. But to your point, one of the main things I see if a guy comes into me with erectile dysfunction, which is I can't get or keep a good erection, usually I look at what's your blood pressure. That's something usually that's it. What's your blood sugar? Diabetic, pre-diabetic. What's your cholesterol? That's usually not normal. And then what is your waist size? Everybody focuses on what we call the body mass index. That's what I measure your waist size at the level of the belly button, not the pant size. Everybody's gonna try to. I don't care about your pant size. It's not your pant size. It's what's hanging over the belt is what's worrisome. So for a man, if you take a tape measure and measure yourself at the level of the belly button, it should be less than 40 inches. Should be less than 37 and a half, but we let you go less than 40. And for women, it should be less than 35. And then optimal is even less than that. So the things I've been talking about with food and metabolic problems, these are just as true for women. They can cause all kind of problems for women too. But when I look at men when they come in with erectile dysfunction, that's what they have. So the first thing I tell them is all these other issues, if we address those, it's going to greatly help your erections. So
it is possible to have a total prostatectomy or removal of the prostate and still be able to naturally get an erection.
Yes, it is. So we do what we call nerve sparing procedure, where we spare those nerves, and it is absolutely possible to do that. And again, it's also absolutely you're in the better condition you are going in, the better that's going to be. But it's called nerve sparing. So that's possible. Now, a lot of men and a lot of Black men, they'll tell me, I don't want to know about prostate. I don't know anything about if I have cancer, because I would never get anything done about it because I'm gonna lose my erections. And then I listen to them and then I just kind of say, okay, I understand what you're saying, but two things. One is we're very good at treating if that were to happen. So one, if you said the best scenario would be if you didn't have it, whether you have surgery or radiation, but we're good at treating you if you need it. And then I also say, but if you're dead, then it's not gonna matter what kind of erection. There's only one kind of, you might get an erection, rigor mortis, but that ain't gonna do you any good. So you gotta have fun with men. You just got
Clearly.
Oh my gosh, I'm never gonna go. This guy is crazy.
You guys won't even get vasectomies, even though, again, that is less surgical than having a woman take out her.
The knives are coming out now.
I'll tell you what my urologist told me as I was walking out of his office out of a vasectomy. He said, "Oh man, I would never do that." Why would you wait till now to tell me that? He said, "You wanted it, not me."
The myths.
But I'll tell you this: part of in defense of being with urology, I think we know too. For me, if I had a vasectomy, you'd have to put me out because I just know too much of what's going on. You know what I mean? It's a very straightforward in-office procedure, especially when you do a lot of them. But I just know too much. I was like, I'd have to be out or heavily sedated because I'd be critiquing everything you did.
Well, I thought
she'll take that.
You're right.
Honestly, I thought I would be out. I was surprised to find out that I'm awake during this thing.
Yeah. It's usually local. It's a local procedure. Yeah.
One more question for you, and this is a doozy here though. So, but you mentioned about the nerves that are preserved around the prostate. That those are not sensory nerves, correct?
No, they're autonomic nerves. They help to control blood flow,
and dilation of blood vessels.
Dilation of blood vessels, relaxation of tissue. Yeah.
So the reason why I asked this is because this is probably 25 years ago. This one guy tells me probably more information than I needed to know, but he says that this is bad. So his girlfriend, he was like, "You got to try this," and I said, "I don't think I'll ever try this though." But he and I just want to know physiologically how this works. But he claims that right at the verge of climax, sexual climax, if his girlfriend basically does a DRE on him and palpates or puts pressure on his prostate, that creates an incredible sensation for whatever reason. And I couldn't for the life of me figure out how that actually works, because first of all, that doesn't seem like that would be pleasant to me at any way. But are there certain nerves in that area that
Yeah, I mean, I really can't think of a good physiologic reason. I mean, like I said, there are nerves that run right alongside the prostate, and maybe there's some sensory elements in there. Maybe it's just the compression factor that enhances the actual orgasm or ejaculation. I don't know. I have to look at that up. I'd have to think about that one. I can't think off the top of my head.
You don't need to. We're not going to encourage you to do that.
Just for our listeners, I'm not encouraging that you go out and try and experiment. It's just something that I've heard.
You guys get enough pleasure without it.
Oh man,
Enough said. That's my point exactly. Trust me, it's good enough. I don't need any additional enhancements.
I get her to say that. I am trying to keep us out of trouble here. She's like, oh, let me help these people, because they're gonna just dig a hole and not be able to get out of it. So
I do want you in the comments to put whatever link you have to the 90 mil thing that you referenced.
Oh yeah, I can put that in. Let's see.
Yeah,
in
for
the chat. Yeah.
Well, we'll include that on our Facebook link too. But can you tell us what that is? What that link is?
This is just to the main website. It's just heal90.com. It's just to the main. It's just to the website.
Heal.
And the website has a lot. HEAL 90. All one word. HEAL 90. Heal90.com. And that takes you right to the website. You'll see something about my story. Tony Hope, my patient and business partner story. Really interesting. And how we kind of put this together. So,
well, thank you so much for joining us on the Roundtable Consult today and indulging all of Sonia's crazy questions. But it has been a delight having you on here. But thank you also for everything that you're doing to help promote men's health. And I know that's a passion that you now have, and being one of those pioneering, I think, Western trained medical doctors who now understand and promote the values of healthy living.
All right. Thank you all for having me.
Thank you. Have a good day.
All right.
Well, another great show for this month. I mean, I'm kind of excited to see what else we'll be talking about this month for Black History Month, but so far, so good. You actually have some decent friends after all.
Of course I do. I mean, you're the worst of all of them.
I was going to say, you may have lost one today.
But no, we actually will have next week. I believe we'll have a nephrologist coming on, and he'll be talking about, again, still Black health matters, kidney disease, hypertension, diabetes, these types of things that, again, are better controlled with lifestyle modifications and information that we need to know. And when I say health matters, meaning two definitions, one being topics, so Black health topics, but also Black health matters means that it's important for us to maintain our health. So tune in with us next week for that very important show as well.
Yes, and of course, you can catch all of our past episodes on your favorite podcast platform, as well as right here on Facebook. And don't forget to go over to our YouTube page, do subscribe there, and check us out on Star Radio. So until next Saturday, thank you guys so much for tuning in.